Good evening, everyone, and welcome to the 2035th daily uninterrupted webinar of the International Forum for Promoting Homeopathy. I am Adia. I'm a third year student from ANSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. And today, our chief guest is Dr. Rishita Shah. She's a MD scholar and she's an assistant doctor at Om Homeopathic Clinic, Gujarat. And today, she'll be speaking to us about mental well being from a point of view of VIKSHIT Bharat and the pillars of mental well-being. So welcome, ma'am. Dr. Rishita, the dais is all yours.
Okay, good evening everyone. Today's my topic is mental well-being as a pillar of VIKSHIT Bharat, insights from homeopathy. Now, what is mental well-being? Mental well-being is not simply the absence of mental illness, it is a positive state where an individual is able to manage stress effectively, maintain emotional balance, build healthy relationships, function productively in daily life. These all called as mental well-being. It also includes three major components: emotional well being, psychological well being, and social well being. In today's fast paced life, mental balance is constantly challenged, and therefore, mental well being becomes essential for a meaningful and productive life. According to the literature, mental health has become a national priority in India because it directly affects quality of life and overall health. It forms the foundation of individual and societal development. Now, mental well-being in public health. In recent years, there has been a significant rise in mental health problems like stress, anxiety, depression, and lifestyle related disorder. अभी हम देखते हैं कि कुछ छोटा मोटा भी हो जाए तो जल्दी से एंजाइटी आ जाती है, स्ट्रेस आ जाता है, कोई भी वो 1% है वो डिप्रेशन में चला जाता है, वो अभी वो प्रॉब्लम्स अभी पीक पे है. So, this rise is due to multiple factors like urbanization, work pressure, competition, social isolation. As a result, mental health has become a major public health concern in India. There is a growing need for healthcare systems that are accessible, affordable, and holistic. एक ऐसी सिस्टम चाहिए इसके लिए कि जो एक्सेसिबल भी हो, अफोर्डेबल भी हो और होलिस्टिक, मतलब कि पेशेंट एज अ होल देखे. बिकॉज मेंटल हेल्थ कैन नॉट बी ट्रीटेड इन आइसोलेशन. सिंगल मेंटल हेल्थ कैन नॉट बी ट्रीटेड. It requires a mind-body approach. Now, mental well-being and national development. A mentally healthy population is work more efficiently, makes better decision, and contributes positively to society. Now, what is mentally healthy population and what is mentally unhealthy population? A mentally healthy population is work more efficiently, makes better decision, and contributes positively to society. On the other hand, poor mental health or mentally unhealthy population leads to reduced productivity, increased healthcare burden and economic losses. एक छोटा सा एग्जाम्पल है कि अगर हमको हेडेक होता है, सिर में दर्द हो रहा है, तो उस दिन हम अच्छे से काम नहीं कर पाएंगे. अगर रीडिंग है तो रीडिंग भी नहीं कर पाएंगे. तो उसका एंड रिजल्ट क्या होगा? हमारी प्रोडक्टिविटी कम होती है. उससे अगर हम कोई बिजनेस करते हैं तो उसमें इकोनॉमिक लॉसेस भी होने के चांसेस है. मतलब ये छोटा सा एग्जांपल है. सो मेंटल वेल बीइंग इज नॉट जस्ट अ मेडिकल इश्यू, बट इट इज डायरेक्टली लिंक्ड टू इकोनॉमिक ग्रोथ, social harmony, and national progress. This clearly shows that mental health is a pillar of Viksit Bharat. Now, concept of Viksit Bharat. What do you mean by Viksit Bharat? Vikshit Bharat refers to a developed India by 2047. Vikshit Bharat means developed, healthy, and self-reliant India. It focuses on economic growth, social harmony, social well-being, health system strengthening. सोशल इकोनॉमिक ग्रोथ तो है ही, सोशल वेलबींग भी है, लेकिन साथ में हेल्थ सिस्टम वो भी वो भी अच्छा होना चाहिए. इट इज नॉट जस्ट अबाउट वेल्थ, इट इज अबाउट क्वालिटी ऑफ लाइफ, not health, quality of life. A developed nation must ensure that its citizens are physically healthy, mentally stable, and socially secure. Thus, mental well-being becomes central to this vision. Health in Vikshit Bharat vision. In the vision of Vikshit Bharat, health plays a central role. The national health policy emphasizes universal health care, expansion of mental health services, and integration of traditional systems like Ayush. This shows a shift from disease-based care to holistic health care. Mental health is now being recognized as equally important as physical health. Now, role of Ayush in Vikshit Bharat. What do you mean by Ayush? Ayush stands for Ayurveda, Yoga and Naturopathy, Unani, Siddha, and yes, Homeopathy. Ayush systems are being integrated into the public healthcare system. They focus on prevention of disease, holistic healing of disease, and individualized treatment. Homeopathy, in particular, has a unique approach. It treats the person as a whole. It considers mental and emotional systems. It focuses on root cause rather than just symptoms. According to homeopathic philosophy, emotional disturbances often precede physical disease. अगर इमोशंस में भी कोई डिस्टर्बेंस होगा तो चांसेस है कि हमें फिजिकली डिसीज भी होगा, which is called as psychosomatic disease in our science. So, by treating mental imbalance early, we can prevent disease progression. Various studies and clinical observations suggest that homeopathy is useful in anxiety disorders, stress-related conditions, mild and moderate depression, psychosomatic disorders, and patient often reports improvement in sleep, emotional stability, coping ability. Also, homeopathy is cost-effective, safe, and suitable for long-term use. This makes it highly relevant for public health. Now, conceptual framework of mental health and homeopathic care in the vision of Vikshit Bharat. The conceptual framework of this article is based on the interrelationship between mental health and homeopathic principles and the national vision of Vikshit Bharat by 2047. At the core of the framework is mental health and emotional well-being, which directly influence individual productivity, social harmony, and quality of life. Emotional imbalance, stress, and functional mental health problems act as key determinants affecting overall health and national development. Let's see from framework. If a person has facing socio-economic and lifestyle changes like stress, competition, urbanization, work pressure, etc. So it is possible that he or she may get disturbed emotionally and mentally by means of stress, anxiety, emotional imbalance, and functional disorders. Here, holistic assessment of the individual is needed in form of mind, emotions, and physical health. So here, role of homeopathy comes. Why homeopathy? So homeopathic approach includes individualized treatment, mind body integration, and also holistic healing. By this, restoration of emotional balance is done by improved coping ability, emotional balance, and stress reduction. By this, one can prevent mental health care by reduced disease progression, improved quality of life, and positive health outcomes, by productive individuals, social harmony, and reduced health care burden. And these ultimately impact on Vikshit Bharat by means of sustainable development, inclusive growth, and long-term well-being. Right? Then comes my aim and objectives of my study are to explore the role of homeopathy in promoting mental health and emotional well-being within the vision of Vikshit Bharat and its potential contribution to sustainable national development. To review existing literature on mental health and emotional well-being in the context of India's Vikshit Bharat vision. Now, literature review. Here, I have gone through many review. First, we'll see by WHO Mental Health in India during 2022 to 2024 updated reports. These articles having national and global observational data which shows India bears a significant mental health burden with around 2,443 dailies per 1 lakh population and an estimated economic loss of USD 1.03 trillion. The National Mental Health Survey during 2015 to 2016 reported that about 10.6% of the population is affected by mental disorders. These conditions contribute greatly to disability and economic loss. With increasing cases of anxiety and depression and a large gap in access to treatment. Next one is from National Mental Health Survey, also called NMHS India 2016 and published in 2020. Having type of data, population based epidemiological survey stated that a large national survey of 39,532 individuals across 12 states in India showed that about 10 to 11% of adults suffer from mental disorders. It also revealed a significant treatment gap of 70 to 80%, indicating that many people do not receive timely and adequate mental health care. Next one from Mental Health and Economic Burden by WHO World Health Organization or World Economic Forum estimates. During 2016 to 2022, here data are economic burden and productivity loss analysis, which observes that mental health conditions led to substantial economic losses due to reduced productivity, absenteeism, unemployment, and long-term disability, posing a major challenge to national economic growth. हियर मेंटल हेल्थ कंडीशन मतलब कोई भी मेंटली इलनेस होगा तो नॉट ओनली इकोनॉमिक लॉसेस बट ऑल्सो कॉजेस रिड्यूस प्रोडक्टिविटी एब्सेंटिज्म मतलब वो पर्सन ही नहीं जाएगा काम पे अनएम्प्लॉयमेंट एंड लॉन्ग टर्म डिसेबिलिटी राइट सो हियर disease impacts on also socially. Now next one is Telemanas National Mental Health Helpline by Government of India during 2022 to 2024. Service utilization data observes that India's National Telemental Health Helpline has received around 2.5 million calls since its launch, including about 39,000 related to suicide distress. We can see the ratio of suicide are also increased. This high number of calls shows increased awareness but also highlights unmet needs and the growing demand for mental health services. Next one from NSS 71st round by Ayush Utilization in India during 2014 and published in 2017. Gone through National Health Utilization Survey and stated that around 6 to 7% of outpatient care uses Ayush systems. मतलब any of these five, Ayurveda, Ayurveda, Yoga and Naturopathy, Unani, Siddha or Homeopathy systems, homeopathy widely utilized, especially for chronic and functional disorders. Next one from CCRH, Central Council of Research for Homeopathy, Homeopathy Case Registry in India by 2019 to 2024. Gone through clinical observational registry, observes that documented improvement in anxiety, stress, sleep disturbances, and emotional imbalance following individualized homeopathic treatment. Next one is from observational case series on anxiety and depression from IJRH and IJHS journals during 2020 to 2022. Gone through clinical observational studies, observes that reduction in anxiety, depression, and stress scores with homeopathic medicines, improved quality of life, and emotional stability reported. Next, from Ayush Integration in Indian Public Health Policy in 2025. Type of data is policy and implementation analysis. Observes that integration of Ayush improves healthcare accessibility, supports preventive care, and reduces burden on conventional health systems. Yes, here in all my literature review, I have also give this site from which I have taken this data. Now next will come methodology. Here my study design is retrospective systematic review of existing literature. I have reviewed all existing literature. This study focuses on mental health first, then emotional well-being, then homeopathy, and last one is national health policy in India. My data sources are from PubMed Central, Science Direct, ResearchGate, government portals, and World Health Organization publication. I have searched keywords like VIKSHIT Bharat and mental health to know the relationship between VIKSHIT Bharat and mental health. Next one is homeopathy for anxiety and depression. Yes, I have searched this for Role of homeopathy in cases of anxiety and depression. आयुष इंटीग्रेशन इन मेंटल हेल्थ केयर. आयुष मेंटल हेल्थ केयर में क्या करता है? और अल्टरनेटिव मेडिसिन एंड इमोशनल वेल-बीइंग इन इंडिया. These all publications are taken from time period during 2015 to 2025, during these 10 years of period. My inclusion criteria are: I have taken peer-reviewed articles, then policy documents, and yes, systematic review relevant to India or similar health system. My exclusion criteria are: non-English publications and opinion-based article without empirical or policy relevant. Only opinion होगा तो वो article मैंने नहीं लिए है, right? Now my method of analysis are thematic analysis, and thematic domains are: first one is mental health priorities in विकसित भारत. विकसित भारत में mental health क्या प्रायोरिटी है mental health की. Then homeopathic approaches to mental and emotional well-being. And last one is policy integration of alternative medicine. Policy integration of alternative medicine. Result: mental health priority. First one is mental health in Vikshit Bharat. The reviewed literature consistently recognizes mental health as a core determinant of national productivity, social stability, and sustainable development. Policy documents and government reports within the Vikshit Bharat by 2047 framework emphasize preventive mental health care, early intervention, digital mental health services, youth mental health, geriatric care, and workplace well-being as strategic policy. Here we can see Vikshit Bharat में not only individual care but also workplace well-being and digital mental health services also included. Also age भी यहाँ पे youth भी है और geriatric भी है. So national initiatives highlight the role of mental well-being in strengthening workforce resilience and reducing long-term healthcare and economic burden. Observational data further reveal significant regional disparities in access to mental health services, particularly in rural and underserved areas, contributing to a high treatment gap. Mental health is increasingly linked with non-communicable disease control, health aging, and productivity enhancement, reinforcing its importance in achieving inclusive and sustainable national growth. Next one is homeopathic approaches to mental health. Evidence from observational studies. Yes, I have done observational studies. Case series and systematic reviews indicates favorable outcome of homeopathic intervention in anxiety disorder, stress-related conditions, mild to moderate depression, and psychosomatic diseases. Individualized remedies such as Aconitum napellus, Ignatia amara, Lycopodium, and sulfur are frequently reported in the management of emotional disturbances. Here, only 4 medicines are given, but we know homeopathy has individualized treatment, so many other remedies will come. Clinical observations show improvements in sleep quality, मतलब sleep उसकी अच्छी होगी, इमोशनल स्टेबिलिटी, स्ट्रेस टॉलरेंस, अच्छे से वो स्ट्रेस को कोप अप कर पाएगा, एंड ओवरऑल क्वालिटी ऑफ लाइफ विथ मिनिमल एडवर्स इफेक्ट्स. Systematic reviews indicate that homeopathy provides beneficial outcomes in certain cases, especially when used as a complementary approach in patient care. These findings support the role of homeopathy as a patient centered. Why? Because it has individualized approach. Also holistic approach, मतलब के mind body approach, addressing both emotional and physical dimensions of mental health. Third one is policy integration of alternative medicine. India's healthcare system includes Ayush systems as part of national programs like the National Health Mission. Around 6 to 7% of outpatient services use Ayush therapies. Any of these five, again, Ayurveda, Yoga and Naturopathy, Unani, Siddha and our homeopathy, with greater use seen in chronic, functional and stress-related conditions. Homeopathy is one of the most commonly used systems, especially in community and public health settings. Collaborations between the Ministry of Ayush and international organizations have improved research, institutional support, and global recognition of traditional medicine. However, issues such as lack of standardization, need for stronger clinical evidence, and limited collaboration with modern medicine still affect its wider integration into mainstream mental health care. Now comes to discussion. These retrospective review combines national, clinical, and policy level evidence to show the importance of homeopathy in addressing mental health challenges within the vision of Vikshit Bharat by 2047. Its holistic and individualized approach fits well with preventive healthcare and community based mental health strategies. Homeopathy can be especially useful in rural and underserved areas where mental health services and professionals are limited. Its low cost, accessibility, and preventive nature may help reduce the treatment gap and economic burden of mental illness. However, the literature also highlights the need for stronger scientific evidence. More well designed studies, standardized outcome measures, and interdisciplinary research are necessary for its wider acceptance. Better collaboration between conventional medicine and Ayush systems can further improve mental health services and policy implementation. Conclusion: mental health and emotional well being are essential for India's journey toward becoming a developed nation by 2047. We only thought by developed nation are from only economic और कोई बिजनेस होगा या कोई अच्छी इनकम आएगी उसको ही हम डेवलप्ड नेशन बोलते हैं, लेकिन नहीं, इसमें डेवलपमेंट नेशन में उन्होंने हेल्थ को भी इंक्लूड किया है, मतलब हेल्थ भी इंपॉर्टेंट है. These retrospective review suggest that homeopathy, as part of India's integrative healthcare system, provides a safe, holistic, and supportive approach to promoting mental health. With strong policy support, increased research, and better collaboration across healthcare systems. Its role in preventive care, emotional strength, and quality of life can be enhanced. We'll see in this. We had gone through in discussion here. The literature also highlights the need for stronger scientific evidence. एविडेंस बेस्ड रिसर्च चाहिए और मोर स्टडी चाहिए. तो कंक्लूजन में यही है कि अगर वो स्ट्रांग होगा तो हम नेशन को हेल्दी रखने के लिए और विकसित भारत के लिए हम उनको हेल्प कर पाएंगे. लाइक स्ट्रांग पॉलिसी सपोर्ट, increased research and better collaboration across healthcare system. Its role in preventive care, emotional strength, and quality of life can be enhanced. Integrating homeopathy into evidence-based mental health strategies can help build a resilient, productive, and emotionally healthy Viksit Bharat. Future scope of study. This study have some future scope in clinical research expansion. Well-designed randomized controlled trials can strengthen evidence for homeopathy in mental health conditions such as anxiety, depression, and stress-related disorder. I must say not only these disorders, but in all disease conditions. We needed randomized controlled trials because उससे क्या होगा कि हमें एक एविडेंस मिलेगा जो हमें हमारी पैथी को वो अच्छे से शो कर पाएंगी कि वो क्या कर सकती है. प्रूफ नहीं होगा तो अच्छा नहीं तो वो प्रूव नहीं हो पाएगा. सो वेल डिजाइन्ड randomized controlled trials can strengthen evidence for homeopathy in all conditions. Then policy integration findings may support the inclusion of homeopathy in national mental health programs, especially in community and primary healthcare settings. In preventive mental health care models, homeopathy can be explored as a preventive and supportive therapy to reduce disease progression and healthcare burden. Next one is rural and underserved populations. Future studies can evaluate homeopathy's role in improving mental health care access where specialist services are limited. मेन इन रूरल एंड अंडरसर्व्ड पॉपुलेशन वहां पे उतनी अवेयरनेस नहीं है, तो वहां पे अभी पहले तो कम थी, अभी तो आ रही है, लेकिन फ्यूचर स्टडी कैन इवेल्युएट होम्योपैथीज रोल इन इंप्रूविंग मेंटल हेल्थ केयर एक्सेस इन स्पेशली रूरल एंड अंडरसर्व्ड पॉपुलेशन जहां होम्योपैथी वो नहीं जानते हैं, तो वहां पे हम सर्व कर सकते हैं. In interdisciplinary collaboration, integrative models combining homeopathy with psychiatry, psychology, and public health may improve patient-centered outcomes. इसके लिए तो अभी एमडी में भी एमडी साइकियाट्री वो सब भी आ रहा है, तो अभी आगे तो कुछ देखते हैं क्या होता है. नाउ इन इकोनॉमिक इम्पैक्ट असेसमेंट, research can assess the potential of homeopathy in reducing mental health related economic losses through improved productivity and reduced absenteeism. These study having role in all area, in clinic, in community, yes, in health, in rural and underserved population, also by branches of medicine, and also by economic way. These all are my bibliography from where I have taken this all literature.
It's really a very good session.
Thank you, sir.
I'm inviting Dr. Manoj to say a few words on this presentation.
Yes, thank you, Dr. Ganesh. And of course, you all must congratulate this fellow doctor. Beautifully presented. Moreover, I think the relevance, the homeopathic fraternity should recognize the importance of such kind of thinking as well as such developments in the present the contemporary world. Because by 2047, India is all set to develop into a developed country. And what are the impact it is making on the society as well as the medical field? The Malayalam session, we have already discussed this program, and there was a presentation from one of the Dr. Jayabhai is a cardiologist, and he presented beautifully what are things expected technological developments in the this management of diseases as well as the introduction of the artificial intelligence, how the doctor should prepare to face the challenges.
Yes, sir, exactly.
Yes, anyway, I'm very, very happy and you made a beautiful presentation. And again, the impact of this mental health, that was, I think, nobody is thinking about that. Everybody is discussing about development. By 2047, we become the developed country. So we have to improve our GDP or per capita income to 5 times. All this is okay. But even though the everything is improved, what is the result? The mental health is not improving.
Yes,
So
sir.
that's a very important question. And I think you have the potential to develop a great personality in the field of homeopathy, the future homeopathy, as the planning board homeopathy, I think you must be. Anyway, nice presentation. Thank you.
Thank you so much, sir.
Yes, exactly. That's what we are looking for. We used to say that health by all for 2000. That was a slogan when we were young and dynamic, and that was the time we used to say in the public also that health for all by 2000. But what happened?
Yes.
By about 2000, most of the people become disease personalities rather than healthy persons, because the number of the so-called lifestyle diseases in the early time, it was not like that. It was known its name itself. But nowadays things are different. From 2000, they give more naming to the diseases, that's lifestyle diseases, autoimmune diseases like that. The classification become different, and the more and more people are added to the patients list, and more people were used to take medicines. And according to the modern people, only the treatment is they have only the treatment for all these things, but they are only having management of these things, and they are having no treatment at all. They just simply manage the treatment.
Symptomatic treatment देते हैं वो लोग. Only symptomatic treatment.
Yes, that means that if you have a patient coming to you with a problem, if you are able to cure the patient, then we can call it as a cure, and that is the specific treatment. But this is only management of the condition. That's what most of the modern people call that. Oh, we are having treatment for all these things, but actually it is not. So in these circumstances, I think. Doctor, at the time of Manmohan Singh, Dr. Manmohan Singh, there was a No, at the time of Dr. Mr. Narayan Singh Rao, our former chief prime minister, there was a minister called Anpumani Rama Rao.
Ramdas, Ambumani
Ramdas.
Ramdas. Yes.
Anpumani Ramdas. He's from Tamil Nadu. He was the health minister. He was the person who brought to this the importance of eye system in India. So he started this. He tried to integrate all these systems, work under one roof. But naturally, what happened was the so-called modern people resisted it, particularly in Kerala. But then in North India, there was no problem. They were mingling together, working together under one roof. But in Kerala, their official organization totally reject this idea, and since then we have a separate system called I system under health ministry, but it is a different ministry, and these Ayurvedic doctors, particularly Ayurveda, homeopathy, yoga, all these people have to sit together and work together. But the so-called the modern people are sitting in their own shelters. That's not happened. Actually, when Mr. Narendra Modi ji become the prime minister, he took it back and he started speaking about the eye system and the need of eye system or the integrated system into the world, all over the world. So that propaganda, but particularly he was more interested in yoga, and India become the hub of yoga, and thereafter all other part of the world also they are started accepting our systems, and now things are different. We got the separate ICE ministry under the control of ICE system, but still homeopathy is there added. But the thing is that homeopathy is not getting proper benefit out of this thing. That is what
Well,
I'm.
Dr. Dhanesh, I think we can invite Tacit and Larry as well as Dr. Ram Parvez Shah, who is there.
Yes, because we have more than 10 minutes remaining. That's why I'm talking, because all these people
Yes.
have to take time.
Ram Parvez Shah sir is a good listener always.
Thank you. Thank you.
Definitely. Yes.
Thank you, Dr. Dhanesh ji and Dr. Manoj ji. And congratulations to Dr. RISHITA Shah for her insightful presentation on mental health, well-being as a pillar of VIKSHIT BHARAT.
Thank you, sir.
IFPH is a very essential pathy, mental health, and Oscar homeopathy is the important and mental health treatment. Very homeopathy is a individualization treatment. Individualized treatment. Each patient is treated based on unique mental symptoms. Homeopathic treatment. And second, minimum dose, है ना? Minimum dose, gentle, safe, and gentle, safe treatment, है ना? और तीसरा miasmatic, homeopathic miasmatic approach, address root cause of chronic mental disorder. So chronic mental disorder, first anxiety, depression, stress, mental disturbance, anxiety, depression, stress, and fear, phobia, etc. Many kinds of medicine, homeopathy, mental disorder, and anxiety, mental disorder, aconite, argentum nitricum, argentum, and fear, restlessness, etc. And depression, natrum is a very good remedy. Natrum and the aurum metallicum, very good remedy. And stress, for stress, nasumka, Nasunka is a very good remedy, and Califos, irritability, etc. And the fear, phobia, astomonium, yani lot of medicine, mental health care, है ना? So
Yes, sir.
homeopathic is the best and important role of mental health. So very
Definitely.
thanks, Dr. Shah. Thank you.
Yes, sir. I think we can add
Gargar homeopathic, Hargar homeopathic, mental.
a few more medicines in the case of Staphylococcus aureus. A lot of integration, vexation from this era. Definitely, as everybody is very busy and everybody is thinking of making money, naturally, the more people affected with this integration, this worries, then loss of sleep, anxiety, then coagulation and medicine. Then what about the economic impact that can be created by homeopathy if this adopted nationally in treating mental disease according to your version?
सर एक्चुअली जब हम देखते हैं मॉडर्न साइंस में तो
Please,
उसमें
English, please.
सॉरी सर
National
when we
language
see
Hindi. National language is Hindi.
Well, this is international sir. Okay, please.
it's okay sir when we see in modern medicines we can we see that consulting charges plus medicine charges
Yes.
total of these two monthly we can say around 4 to 5,000
5,000 rupees per
4 to
month.
5,000
minimum 5,000
monthly हो
rupees.
जाता है.
Then what about the prevalence of this disease, mental conditions in India?
Prevalence of mental conditions in India.
Mental disease, yeah.
Not curative way of treatment, modern medicine. Only
Yes.
for palliative way of treatment.
No, I am asking about the magnitude of the economic magnitude of this problem.
Just a minute, sir.
I think you mentioned about 10%, isn't it?
हाँ मैं वही देख रही हूँ sir.
Yes. Because recently there was a study in the treatment of obesity. It says that around 10 to 15,000 rupees per month for treating obesity earlier days. Now it has reduced to 5,000 rupees because of the patent. A few companies also produce the same medicine after the period of the patent time. So just like that, we should have a calculation. Then we should project a project of the impact of the government adopting this homeopathy, how much money can be saved. Because
Yes.
most of the medicines as well as the methodology is coming from West. So naturally, we have to spend money over other nations. But if we develop an indigenous system like here in homeopathy, definitely we can save hundreds of thousands of dollars.
Yes, Doctor, I think Dr. Prakash Rao has made such a presentation earlier, and in which he has suggested that if people who used to take homeopathy for these things, we can cut short the money spent for this mental condition to 25% at least.
35%. Yes, sir.
25 to 50%. That was his recommendation.
So it's my suggestion to you, doctor, because we should have a definite answers to such questions. You can express such questions, especially when you are facing a public platform.
Okay, sir.
Definitely the media persons or the civil service officers, they are always seeking the question, they are seeking answers to this problem. Even the politicians, they will ask, how much is the impact? The social impact, the economic impact, the feasibility. Well, all these things should be studied in homeopathic colleges as well as through our brains, the ossified brain of homeopathic physicians. It is not at all amenable to these things. They would know only about belladonna, bryonia, and axomic and so many things, but that is not enough. We have to adopt the technology, we have to adopt this according to people and situations. Otherwise, just like it will not, we cannot survive, I think.
Yes, sir.
Survival of the fittest, yes.
Yes, sir. So,
Yes, what is the present situation in your state about this homeopathic application of medicine to these kind of patients?
sir,
And
actually,
how many, is there any research center from CCRH or National Council of Homeopathy there in your state?
when I gone for the homeopathic and allopathic modern medicine, patient which pathy are choosing, but exact data are not available.
No, my question is, what about the present situation in your state uh, in the management of these mental conditions? Whether your state government has any such a proposal or any project to undertake homeopathy as a treatment for this.
Under CCRH, I am not knowing that, but
You are from Gujarat, I think.
yes, sir.
Yes, sir. What is the present situation? Whether what kind of is there any directorate for special directorate for homeopathy at Gujarat? And because we know that there are more than 46 homeopathic medical colleges
Yes, sir.
in Gujarat. Uh, what about the directorate? Is there any specific directorate for homeopathic practice?
Separate directorate, that is Dr. Ganesh mentioned.
Yes,
Separate
yes, yes,
directorate.
yes. Or otherwise, only collegiate directorate is there.
No, sir. अभी तो मतलब today's scenario in today's scenario, many patients directly come to homeopathy because of awareness, social medias.
No, that we know. Well, no, the question is whether in Kerala we have a directorate for homeopathy. It is a separate one. Which
Department
comes
of Homeopathy Directorate, yes.
it is Department of Homeopathy Directorate under Kerala government. What about the situation in the so?
I'm not knowing, sir.
Yes,
Yet.
well,
Why? That's a problem. Yes, we should be
being
well
a
aware of these
homeopathy,
things.
you should know what is happening around your
Yes,
area and what is happening because since this much of colleges are there in Gujarat, that means more than if you consider 50% for that means more than 2,000 to 3,000 young dynamic doctors are coming out from your colleges. Whether they are getting any job in your state, that is the biggest challenge because here we in Kerala we have more than 16,000 homeopathic doctors, registered A-class doctors, and out of which we have more than 1,000 homeopathic doctors in government sector. That means the government sector is giving a minimum 10% service to these young dynamic doctors. So we will have to implement such things in all states in India so that more and more doctors will get a government job and it will be an attraction to the young dynamic persons who are still struggling to get their practice at the younger age. So we will have to think in that because you people need that's what the organizations or association need to work in that way. So you people you will have to make suggestions to all the organizations and request them to do these things. Anyway, I am inviting Dr. Ramresh to start to say a lot of thanks to the session.
Thank you, sir.
Thank you, Dr. Rishita Shah. Very nice, excellent session. Behalf of IFPH, whole team, very, very thanks. Again, presentation. Thank you. Very, very.
Thank you so much, sir. Thank you.
Yes, thank you, Dr. Ramresh sir, and Dr. Manoj, and those who attend the session. And special thanks to Dr. Rishita for coming over here and giving a beautiful presentation on this
Thank you so much, sir.
special subject in today. And
Thank you so much, sir.
tomorrow we will have a session from Dr. Harsha S. Goti, and Dr. will be talking about reverse materia medica, Latina and its repertory signature. So hope all of you will join tomorrow at the same time. Thank you all. Good night.
Thank you.
Good night.